Dr. Berk, I'm drberkkkaratas. We will be talking about testosterone. I will prepare 2 videos. In the first video, how is the mechanism of testosterone formation controlled? What should we look at to measure testosterone? What should we do when there is low testosterone in a blood test? When do we take external testosterone? We will talk about these. In the second video, we will discuss how to keep testosterone at a certain level in individuals with normal testosterone levels or even slightly higher. I will talk about how we should eat regarding this. Now, this pathway is very important in testosterone production. In medical terms, we call this the hypothalamic pituitary gonadal axis. These two are in the brain. As we know, we have 2 testicles. A hormone is secreted from here. From the anterior pituitary, the pituitary gland is a very small gland. It has a front and a back part. From the front part, FSH and LH are secreted, while TSH and prolactin are secreted from the back. FSH causes sperm production in the testicles. LH produces testosterone from cholesterol. The production of testosterone from cholesterol is very important. I will explain this, especially in the second video. One of the areas where we can intervene, meaning where we can improve this situation through nutrition, is this. The second point is that testosterone converts into estrogen. Now, once testosterone is formed, it is released into the bloodstream. So it is released into the circulation. Of course, in order for it to reach the target tissue in the circulation, it needs to bind to some proteins. There are 2 important proteins. There is sex hormone binding globulin synthesized in the liver, as well as albumin. Now, 60% of the secreted testosterone binds to sex hormone binding globulin. The remaining 40% consists of 2% free testosterone and 38% bound to albumin. Now, here are the 2 values of bioavailable testosterone. Actually, we can benefit from about 40% of our testosterone. We can actually get the maximum benefit from that 2% portion. Bioavailable meaning, yes, what happens to bioavailable testosterone in the end? It has a direct effect. A portion converts to highly active dihydrotestosterone. Healthy eating can reduce this conversion and boost testosterone. And some of it also converts into estradiol. So, by eating healthy or establishing a healthy organization through food, we can intervene here, to some extent reduce this conversion and increase testosterone. Estradiol yogurt is a very important female hormone. First of all, this is very important. In men, the testosterone to estrogen ratio, I tell my patients, should be around 13, which is the male to female ratio. This number is very important. Low or high values in this number can lead to some problems. Estrogen is especially produced a lot in fat tissue in men. If a person has excess fat tissue, the conversion of testosterone to estrogen increases. What does estrogen do? Of course, it has many functions. In men, there needs to be a certain level at that ratio, but when estrogen increases, it quickly converts to testosterone. Estrogen suppresses the system on the brain's hypothalamus or hypophysis. Look, it has a negative effect, and therefore this system stops. This is very important. I'll talk about it in a bit. This is the mechanism behind our own testosterone stopping when we unnecessarily take testosterone from outside. Now, this part here is very important. Total testosterone should be between 300 and 1200 units. Let's say we looked and it came out to be 600. The part that we can actually use perfectly and actively is 12 units. Look, that's 12 out of 600, which is an average of 2%. 228 is a bit more of an immediate backup, meaning it's used in the sense that if something happens, it can be quickly utilized and it can dissolve in most tissues. But the body can't really use it beyond 360 under very extraordinary conditions. In fact, 5 to 7 megaton of testosterone is produced daily. A large part of this synthesized in the liver or excreted through the intestines. So we can't use most of it. Now, this is how the system works. If a person's testosterone level comes out low, we consider anything below 300 to be low. What usually happens is that when testosterone is low, we should immediately use testosterone. We should give external testosterone. This is not the right approach. If you go somewhere and a doctor or someone else immediately gives you external testosterone when your testosterone is low, that's a problem. This needs to be questioned, because Without knowing this system, without researching it, immediately taking external testosterone as if testosterone will never be produced again can lead to serious problems. So look at FEJ, TSH. It is very important to know aspergilactin, cholesterol level, sex hormone binding globulin, albumin level and zinc, B12 and D vitamins that can increase or decrease the conversion of cholesterol to testosterone and the conversion of testosterone to esteroids. If you're not looking into these, then it means you don't know your actual testosterone levels. And there's a high probability that you're getting the wrong treatment, or it means that only treatment is being applied. Now the point here is this. It means that only treatment is being applied. Now the point here is this. If a person's testosterone is low, or we look at this system, if this system is functioning normally, then it means there has been an error somewhere in this system. So, for example, a severe deficiency in zinc can significantly increase this conversion rate. In that case, this system might be suppressed. So if this system is generally working correctly, we need to fix an error here to increase testosterone. So what can be done? The conversion of testosterone to estrogen can be prevented. Zinc can be increased, etc. Let's say that elast secretion has decreased. Then external elast can be applied. This could be the place. So a treatment can be applied based on an error here. But you see, yes, testosterone is low and this system is not functioning. So facilities are not working. There are some congenital diseases, genetic disorders, for example, if this system is not functioning and there's no possibility of producing testosterone anymore, then you should take testosterone from outside. And please, don't forget, if someone tells you that you need to take testosterone hormone, the question you should ask 99% of the time is this: I will take it for life? If they say you won't be taking it for life, then there's a problem with this. Because this system is not functioning, you should only take testosterone. And therefore you should take it for life. You can't just take it for a month or two and see what happens. If there's an error inside, the error is fixed. And then your testosterone will increase. This, quite important. And what athletes do? There's something very important. When everything is normal, it's not below 300. For example, when it's 600, testosterone is taken from outside to make it 1200. Look, I mentioned this a little earlier. When you give someone testosterone from outside, there's an excess of testosterone in the body. What will happen? It will quickly convert to estrogen. Estrogen will block this area and it will stop here. When this stops, testosterone production will stop. Yes, when you look at testosterone levels in the blood at that moment, what will happen? It will go up to 1200. But as soon as you stop the testosterone hormone, this system halts. So there will be no sperm production and no testosterone production. Will it come back? There is a possibility that it won't come back. And it is said that if you are taking unnecessary testosterone supplements from outside, there is a 30% chance that you may never produce sperm again. This is very important. Look, it's called azoospermia. There is no sperm production anymore. There's also something called decadic syndrome that I mentioned in previous videos. It's not just pure testosterone. People also take anabolic testosterone, meaning steroids. In such a situation, there can be permanent, irreversible damage related to erections and sexuality. So please, if your testosterone levels are normal, don't take testosterone from outside. But if your testosterone is not normal and is low, first check if these tests have been done or not. If these tests were done and there is no possibility of producing testosterone again, then we need to take testosterone from outside. And we need to take this for a lifetime. But as I mentioned a little earlier, if there are mistakes or issues in these areas, once they are resolved, your test levels will return to normal. This is our first video. In this second video, I will explain the first and second steps, meaning how we can keep our testosterone levels healthy and normal. All right, I will talk about how we can improve our testosterone levels a bit more through healthy eating, or how we can increase it a little as we get older, specifically regarding food. Thank you.